very good morning to all of you, and thanks to the presenter for the very nice presentation. I would like to invite the next speaker, Dr. Mila from the Department of Social and Preventive Medicine. Dr. Mila joined SPM in 2025 with a multidisciplinary background spanning around public health, family medicine, infectious disease, and tropical medicine. Dr. Mila holds a PhD in public health from University of Malaya. She is also an accomplished medical doctor and earned her MBBS from University of Medicine, Myanmar. She further enhanced her career with masters in tropical medicine and family medicine. Without any further delay, I would like to hand in the microphone to Dr. Mila. Over to you, Dr. Mila. We are looking forward to hearing from you.
Very good morning, everyone, and thank you so much, Dr. Rumana, for your very kind introduction. So thank you so much to the organizing committee as well for inviting me to this breakfast webinar. So please let me share my slides. So very good morning, everyone, again. Thank you so much for joining this early morning webinar. So the topic I would like to discuss today is listening beyond the numbers. Why synthesizing the experiences of matters in the recession healthcare? So basically, many of us are from the medical health science background. We prefer to measure the outcomes with the numbers. If we are prescribing the patient with a medication, we look at how about the adherence rate. If we have the new treatment regimen, we try to compare, okay, treatment A and treatment B, which one is better for the survival rate or for the curation. Or otherwise, if we do some health promotion, health intervention, we try to look at, is there any measurable changes before and after the intervention? So these are the usual things we try to look into the healthcare as well as in the research. How about if we listen beyond that measuring with the numbers? So for example, we are dealing with a patient, we are dealing with a community almost every day, even including our students, colleagues. What they might be thinking about. So for example, if we prescribe the medication to the patient with a hypertension, the patient may adhere to the medication or may not be. What might be the underlying reason? What is the experience of the patient taking the medication? How about the traditional belief opinions? So if we consider beyond the numbers about their experience, cultural background, the perspective, that will be very beneficial when we are planning for the treatment, as well as when we are planning for the intervention in the future. So basically, my topic is more related to the qualitative research and synthesizing all the evidences from the qualitative research. Let me introduce a little bit background of the qualitative research. As all of us are very familiar with the quantity as well as qualitative research, I will just quickly go through the slide. Basically, qualitative research is more related to the social and behavioral phenomenon. We are trying to observe in depth, in detail of the human behavior, what might be the underlying factors of their decision-making, healthcare seeking, as well as the medication, as well as the health behaviors. So basically, qualitative research usually aims to consider developing the theories or increasing understanding about the social and complex problems and social background. So nowadays, in addition to quantifying with the numbers of the outcome, we also consider the qualitative perspective when we are providing the treatment or when we are planning for the interventions. Okay, so we have seen a lot of the qualitative research answer in the publications, in the journals, as well as in the presentation. How about the possibility of integrating the qualitative research in a systematic way? Yes, that is possible. If we integrate the qualitative evidences in the systematic way as a qualitative evidence synthesis, it might be the aggregate conception, or it might be the aggregate concept to enhance the planning as well as decision making in the healthcare sector. So now we are moving towards the qualitative evidence synthesis. Actually, qualitative evidence synthesis is the systematic review approach of the published qualitative research articles. So in order to conduct the QES, it will be better if the lead person or the senior person has some background about the qualitative research as well as the systematic review concept, because it is a combination of these two. So basically, qualitative evidence synthesis is a terminology, but some researchers they use as a systematic review of qualitative research, or some researchers they use as a qualitative research synthesis. Actually, basically, it is the same. We usually say as a QES. So when do we do the QES? If we need to have a comprehensive understanding about the complex phenomenon, we may conduct the qualitative evidence synthesis. So when we look at the background about the qualitative evidence synthesis, it is not a new concept. It has been developed since 1980s as the meta-ethnography, after then increasing usage of this qualitative evidence synthesis. And in 2008, Thomas and Hayden thematic synthesis approach is published. So later I will be going through that approach, thematic synthesis approach of the qualitative evidence synthesis, and then later onwards it is increasing trend applying in the healthcare sector. This is the example of qualitative evidence synthesis contribution in the policymaking. So for the qualitative evidence synthesis, it is not just for the publication that is beneficial for the organizations or for the policymakers to include the social complex or the patient preference, various facilitators to access to the healthcare when they are making the decision. So this is the example of the WHO guideline that was published since 2016. So in that guideline, they look at all the quantitative evidence of the antenatal testing as well as the delivery care system. But one interesting component is they also look at the qualitative evidence synthesis, which aggregates the antenatal care, pregnant woman's preference, and their expectation about the antenatal care. So from that qualitative evidence synthesis, we came to know that what the woman wants. They want the positive pregnancy experience, like provision of the effective care, as well as the communication, way of communication, timely information, as well as the supportive way of providing the antenatal care. So therefore, that qualitative component was incorporated in the decision-making guidelines. So nowadays, the WHO as well as the Cochrane Systematic Review are providing the guidelines for this qualitative evidence synthesis approach. This is the step-by-step approach for conducting the qualitative evidence synthesis. So basically, the first three steps are very similar with the systematic review of the quantitative research. First of all, we may need to plan and we may need to consider the topic that we would like to explore more. So planning stage, team discussion, and then reviewing the literature, we started since that time. After that, we will develop the review question. After developing the review question, we will develop the objective of conducting this qualitative evidence synthesis. And we come out with the search terminology and literature search through the electronic databases. So basically, the first three steps are very similar with the quantitative systematic review. After that, methodological quality assessment. That process is also very similar with the systematic review of quantitative research, but we use the checklist or assessment tool that is aiming for the qualitative research. After that, we may also extract the data, especially qualitative data, and we will synthesize these qualitative evidence. So when we are doing the qualitative evidence synthesis, this synthesizing qualitative concept or qualitative data, there are different ways. So in today's talk, because of the time constraint, I will be focusing on the thematic synthesis approach. After that, I will also a little bit going through about the confidence assessment of the findings. So basically, for the thematic synthesis approach, it was published by the Thomas and Hayden 2008 guideline. So it includes three steps. So initially, we will extract qualitative data from the primary studies, and then we may need to go through in detail to get familiar with the concept and content of the qualitative findings. And then we we may do the line by line coding. So when we are doing all this process coding, we can use the software like NPO or other qualitative data analysis software. And then the second step, after coding, we will group the similarities, differences. According to that, we will start developing the descriptive themes. So when we start doing the sub-themes and themes at the stage 2, the findings might be very similar with the primary qualitative research because we just describe what we find in the data. But the next step is the generating analytical themes. So when we are generating the analytical themes, that is beyond the primary studies finding. We may consider what might be the overall interpretation. How about the implication for the practice policy programs, etc.? So this is a very simple way of conducting the thematic synthesis in qualitative evidence synthesis. So after synthesizing the findings, how about the confidence level for each and every themes and sub-themes? So in order to assess the confidence level of the qualitative evidence synthesis finding, we usually use this qual approach. So in order to use this approach, we may register in this website and we can create an account and we may need to enter the information. What references do we use? How about the initial quality assessment checklist, the content, and the finding? And later, we will make the aggregate decision about the confidence level. So when we are making the confidence level about our finding, we do consider on these 4 components. The first one, how about the methodological limitation of the primary studies? So as you can see here, if the primary study quality is not very high, that might impact to the overall aggregate synthesis of the finding. So we may need to do the methodological assessment of the individual study, as well as we will consider that methodological limitation when we are making the final decision about the confidence level for each thing. And how about the coherence of the findings? So as we can see here that, okay, for example, the first study mentioned that the patient preferred the treatment A. The second, because of that reason, the second study preferred that the patient preferred the second treatment B. So if the coherence is different from one study to another, it might reduce the confidence level of the final overall decision making. The third one we commonly face is the adequacy of the qualitative data. So basically, the nature of the qualitative research is the in-depth exploration, and the number of publications may also be limited in the specific area. So when we are trying to do the systematic review of all the qualitative findings, adequacy remains a question. So sometimes even though we extract the data, try to search the literature, extract the data, the adequacy of the data, the quality, the richness, we call it as the richness of the data might be limited. So that might also affect the overall confidence of the findings. Okay, relevancy. So for example, our target population is like for the adolescent or maybe the young adult, but the study include all the children under 15 years. So that might not be completely relevant to our research question. So when we are considering about the relevance of the findings to our study objective, we may need to look at the context, we may need to look at the population difference, as well as we may need to look at the study objective, aims, and relevancy. So based on all these criteria, we may decide the overall confidence level of our qualitative evidence synthesis finding. So basically, when we are doing that sample approach, it is made with the team decision, team meeting. We go through together each and every component of the every themes and sub-themes, and we try to make the overall decision. Let me quickly go through the critical examples of the qualitative evidence synthesis that our team has conducted before. So basically, cancer screening is a very common topic for all of us. So we try to focus for the preventive perspective, eye health promotion, screening, and early detection for the cancer worldwide. So basically, our qualitative evidence synthesis try to explore particularly the experience and perception of the primary care providers. So we search the literature related to the primary care providers' experience, perception about cancers adhering to the cancer screening guideline, as well as recommending the cancer screening to their patients. So for example, we did the research question, we developed the research question, and then we developed the search terminologies, search terms, as well as we did the database search. And then again, when we are considering the database search, usually 3 database search might be a minimally needed, but we try to cover much more. It depends on the availability of the literature. As I've mentioned before, finding the literature for the qualitative research is sometimes might be challenging. We may not get enough data for the primary study. So therefore, we, if possible, we recommend to search from the different sources as much as possible. So for the inclusion criteria, we included the qualitative research as well as the qualitative component of the method research. And critical appraisal was done by using the CAMAP tool, and data synthesis was done by using the Thomas and Hayden chemistry synthesis approach. After the data analysis for each and every themes and sub-themes, we check the confidence level of the evidence from the synthesized theme. And this overall assessment level is classified as 4, high confidence to that findings, or moderate, low, and very low. That assessment criteria is done for each and every themes and sub-themes of the findings. So basically, this is the finding, example finding of the qualitative evidence synthesis. So in that study, we included 9 primary qualitative research that explore about the perception and experience of the primary care providers to recommend for the cancer screening, specifically for the breast cancer screening, cervical cancer screening, and colorectal cancer screening. So as an overall, the primary care providers, they express the positive perception about the cancer screening guideline they would like to recommend. But for the junior doctors, they find it is a bit challenge because they have the limited confidence about recommending the guidelines. So that is the first thing. And second thing is the main thing. What might be the challenges for the primary healthcare providers to provide the screening to the patient? The first barrier they mentioned is related to the patient factor. Even though they recommend, the patient refuse, or maybe fear or maybe misconception. And in some regions, the financial constraint might be a barrier because they may need to pay by themselves if they're not covered by the insurance or other healthcare services. So regarding the primary care doctor related challenges, that is very resonate well in our setting. The high workload and the time constraint is the main barrier. And sometimes the junior doctors might have the limited knowledge about the screening guidelines and then the pathway of the referral. And in terms of system related, some of the studies mention about the shortage as well as the long waiting time, as well as the lack of reminder in addition to the time constraint. So they prefer about the electronic medical record and then pop-up reminder if the patient is eligible for the screening. And community factor, that community factor is directly related to the patient factor, cultural belief, stigma, limited awareness. If we can improve that, that will be enhancing the patient-related factor to take the screening. So basically, theme 3, synthesis finding. So it mentioned about the factors enhancing, we can relate with the challenges. So basically, the integration of the digital tools, reminder system might be helpful to engage and monitor the patient, as well as the also stress out about the public health education on cancer awareness that will be enhancing the patient uptake of the screening. So this is just the synthesized theme from that review, including 9 primary qualitative research. So the key insight we gain from that is like, it is important, right, to implement the screening guideline and simplify it and simplify algorithm that should be like in the form of the soft copy or otherwise in the form of the hard copy poster in the clinic room. That will helpful for the decision made, especially for the busy clinician as well as for the maybe the junior doctors. And another need is like electronic medical record linkage system might be beneficial for the doctors to recommend the screening, and improving the supply chain, providing the adequate test kit might be improving, as well as the reducing the patient level barriers through the integrated public health promotion intervention will be beneficial. So these are some of the key insights from the qualitative evidence synthesis. So the next topic we would like to share is related to the zoonotic malaria. So we also look into that by the lens of the qualitative evidence synthesis. So in Southeast Asia region, we are trying to reduce the zoonotic malaria. So basically, we try to reduce the overall general malaria, so Plasmodium falciparum, Plasmodium malaria. But when we are about to control, then the zoonotic malaria began to increase in burden. So that zoonotic malaria, especially the Plasmodium malaria cases, are increasing in Malaysia, especially in the Sabah Sarawak region. Now it is extending to the Peninsula Malaysia. So what our team would like to look for is how about the community behavior and perspective related to that zoonotic malaria. Because this malaria usually occur in the rural area and especially for those who are working in the farm or those who are working in the forest area. So therefore, it is very important to understand their cultural perspective as well as their preventive measure about that zoonotic malaria. So this is our research question and research objective. So the process is the same. We start with developing the review question and then develop research trend and literature search, and then we use the Thomas and Hayden thematic synthesis approach. And finally, we came up with the themes. So the first theme is like basically when we look at the rural areas experience, the knowledge and the reality, they shape David's perception. So basically, the people from the endemic area like Sabah region, Sarawak region, they are very knowledgeable about this zoonotic malaria. Locally, they call it a dengue malaria. But in terms of Peninsular Malaysia, the awareness about the dengue malaria or zoonotic malaria is still limited. And another one limitation of this review is that the literature is very limited. So in our qualitative evidence synthesis, we were only able to synthesize from the 5 primary qualitative research. The second one is the environmental factor, structural factor, and social barriers about the prevention and healthcare seeking. So, as I've mentioned before, this kind of zoonotic malaria is very related to the environmental factor. So, therefore, the people living in the rural area, they are going to the forest for their daily livelihood, and they are gathering outside. They are working for their farms, plantation. So, when we are considering for the preventive measure, it is very challenging to use the ordinary or normal preventive way of the like insecticide treated mulch or indoor residual spraying. That might not be able to prevent very effectively. So therefore, we look at the barriers for the prevention and health care seeking from the primary qualitative research. So we also mentioned that structural access barrier to the healthcare, their cultural behavior of working in the forest, staying near to the forest, as well as their monkeys around their residential area. These are the factors that challenge for the prevention. And they also consider that like once they are seeking for the treatment, they need to be admitted to the hospital, they have the concern about the family, so that might delay or inhibit the treatment seeking as well. So these environmental, structural, and social barrier constrain them to seek for help as well as for the prevention. So the last one, how do they prepare if they have the constraint about that? So they may use their natural remedies, and they may use their natural method like they use the coconut hash and then bend it, and then that smoke will emit and then prevent the mosquitoes coming to the workplace. Or otherwise, sometimes they may also use the modern form of preventive measure, but some mentioned that these kind of modern measures like mosquito repellents may be like a bit expensive for them. So therefore, when we plan for intervention, that intervention prevention measure should be tailored according to the need of the local context. So from the themes, the key insight from that evidence synthesis review that when we are planning for the popular perspective, community prevention measures, the first one is to tailor the risk communication according to the local culture. Because some they might think, okay, I may not get malaria. So how do we improve the risk communication, awareness, and importance of the early detection and treatment? Because usually for the Plasmodium malaria, the life cycle of the parasite is very fast. It is only 24 hours. So if the patient contracted with that infection, parasitemia can increase rapidly. So therefore, timely health seeking is very important. So we also need to strengthen the community awareness about this. And when we are providing the preventive measure, that should be suitable for their cultural and local needs. So for example, even though we provide the insecticide treated nets, for those who are going to the forest might not be applicable, might not be usable for the insecticide treated nets. So what might be the innovative way of providing the prevention tool that is the needs. for the community prevention perspective. So, but we also would like to admit that the literature is still limited in that area, so we need to explore more about this in the primary qualitative research. Just a quick conclusion about my presentation. So basically, these are the cancer screening as well as the cultural perspective of the zoonotic malaria prevention. These are the examples of qualitative evidence services. So basically, it is the systematic review of the all qualitative available qualitative research, and it is the fastest growing area, a very fastest growing area in the research synthesis methodology. So when do we do that? If we would like to aggregate the qualitative findings to get the answer about the complex social phenomenal approach, then we may be using this method. But we also have some limitation. For example, as I mentioned before, the primary qualitative studies method is still limited in some areas. So therefore, we also need to careful when we are interpreting the findings, as well as the quality of the primary studies are important when we are making the final decision about the confidence level of this qualitative evidence synthesis. And these are some references about the Cochrane Handbook for the Systematic Review of the Intervention. So basically here, the step-by-step guideline of the QES is available for those who are interested to explore and use this method, and the others are related to the initial recommendation for the Moderator guidelines. With that, I would like to thank you for all the audience for your attention. Thank you so much.
Thank you very much, Dr. Mila, for the very, very nice presentation. I enjoyed it thoroughly. Is there any question from the floor about the methods or the pros and cons? Any question from the floor? Can I ask you a question,
Oh,
Dr.
yes,
Mila?
please. Yes, please.
I was just wondering that because normally we do a scoping review, narrative review, or a systematic review, right? And your presentation brought so much new insights on our traditional way of thinking. Would you like to explain a little more about the limitations of focusing only on qualitative research when we do a review? The limitation part and yeah, just the limitation part. Thank you so much, Dr. Mila.
Thank you so much, Dr. Rumana. It is a very good question. So basically, when we conduct the qualitative evidence synthesis, we can do it as a standalone, or we can combine together with the systematic review of the intervention studies. So when we conduct the standalone qualitative research, yes, there are some limitations, especially as I've mentioned before, if the primary qualitative studies are not enough, then our evidence confidence will be limited. And second one is if the primary studies are not high quality studies, that might also affect to the confidence level of our research, our evidence synthesis, as well as another one is the contextual factor. If our evidences are mainly from the developed country, that might not be applicable in the developing country settings. So therefore, we may need to consider, when we are considering the evidence synthesis, we also need to consider about the contextual factor. So basically the generalizability might be one of the limitations of this evidence synthesis as well.
Thank you so much. Another quick question. I'm sure after your presentation, many of our students would like to focus only on qualitative studies when they do a review. Yeah. So, like we have students like in master's program, master's by coursework, and they need to finish everything in a year. And for the research report, they have like around 5 months, one semester. Do you think it's enough to follow this methodology for the students who are taking masters by coursework and the duration of their submission of the research report is like around 5 months? Then I'm going to recommend the students. Yeah.
Thank you so much, Dr. Rumana. Actually, in terms of timeline, if we can commit, it is doable within the timeline of 6 months. However, especially the data analysis, evidence synthesis part, and the confidence assessment part is the teamwork. If the fellow team members or if the supervisor can discuss together, can work together for that steps, that is feasible. Because it is not a single student work, it should be the teamwork to synthesize the evidence to decide the confidence level.
Thank you. Thank you so much again, Dr. Mila. Any question from the floor? We have come almost at the end of today's session, and I would like to thank my heartfelt gratitude to the two presenters today for their excellent presentation. And thanks to all of you for being such a lovely audience.
Thank you so much to everyone. Have a
Have
great
a
day
lovely
ahead.
day, everyone.